Not having a family doctor in Canada can feel impossible. You end up bouncing between walk-in clinics, urgent care, and whoever is available that day. But there is a way to build real continuity, even in this system. This video is Canada only, and it is informational only. It is not medical advice, and it does not replace a doctor or nurse. Think of it as a simple navigation guide you can take into the health system with you. Across Canada, millions of people do not have a regular family doctor. Clinics rotate staff, walk-ins are rushed, urgent care is focused on today's crisis. Notes do not always follow you, and your story can get lost between visits. That is not your fault. The system is patchwork. But you can still make it work better for you. Rule number 1 is the medical one-pager. This is a single sheet that travels with you to every clinic. On it, you write your main conditions, your current symptoms, your medications, and a short timeline of the last few months. You keep it simple, readable, and up to date. When you hand this to a clinician, you give them a fast, clear snapshot of your health story. For a busy clinic, your one-pager is gold. It saves them time, it reduces guesswork, and it shows that you have been trying to be consistent. Even if the electronic record is messy or incomplete, your one-pager acts like a portable chart. This is the foundation of continuity when you do not have a family doctor. Rule number 2 is to lead with impact. When the visit starts, resist the urge to tell your whole life story. Instead, start with one clear sentence. Here is how this is affecting my daily functioning today. Then give 2 or 3 specific examples of what you cannot do, or what has become much harder. For example, you might say, I cannot stand for more than 10 minutes without severe pain. Or, I am forgetting steps at work, even in tasks I have done for years. Or, I am waking up 3 times a night from shortness of breath. Functional impact is what clinicians can act on. It is clearer than a long emotional story, and it fits inside a short visit. Rule number 3 is to ask for a simple plan, not a debate. Near the middle or end of the visit, use this sentence. What is the next step today? That one question helps the clinician move from talking to planning. The plan might be blood work, imaging, a medication trial, a referral, or a simple follow-up timeline. The key is that you leave with a clear, written next step. Rule number 4 is to document every visit. Right after you leave, take 30 seconds and write down the date, the main concern, what was done, and any follow-up advice. You add this to your one-pager or keep a simple log attached to it. Over time, this becomes proof of your efforts and a record of what has already been tried. It protects you from starting over from scratch every time. Rule number 5 is to know where continuity is most likely. In many parts of Canada, community health centers offer team-based care and are more open to complex or chronic issues. Nurse practitioner-led clinics can also provide more consistent follow-up. Some urgent care centers keep internal notes if you return to the same location. When you check in, a simple question can help. Do you keep internal notes if I need to come back here? If they say yes, that is a small form of continuity you can lean on. Not having a family doctor in Canada is hard. You did not create the shortages, and you are not failing because the system is strained. But with a simple one-pager, clear functional explanations, a written plan, and basic visit notes, you can still build continuity in Canada. If this helped, you are not alone. The channel is called The Drill Hall, and it is Canada only. With a simple one-pager and a clear plan, you can still build continuity in Canada.